Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function. After 60, I'm your host, and today we're discussing one of the most reliable indicators of sexual health that most men take for granted until it disappears: morning erections. If you've noticed that you're no longer waking up with the firm erections you had in your younger years, or if morning wood has become rare or non-existent, you're not alone. But here's the remarkable news. There's one vitamin that research shows can dramatically improve or even restore morning erections in men with deficiency. Today, I'm going to reveal exactly what this vitamin is, how it works, why deficiency is epidemic in men over 60, and the specific protocol that can potentially double your morning stiffness within weeks. Before we dive into the science, let me share Thomas's story. At 68, this retired engineer from Boston came to my office with a complaint that's incredibly common, but rarely discussed. "Doc, I can't remember the last time I woke up with an erection," he told me. "When I was younger, it happened every single morning without fail. Now, nothing. My wife and I are still intimate, and I can achieve erections with medication, but the spontaneous morning erections have completely disappeared. I've read that morning erections are a sign of health, so I'm worried that something is seriously wrong." Thomas was right to be concerned. Morning erections, technically called nocturnal penile tumescence, are indeed an important marker of vascular, neurological, and hormonal health. Their absence can signal underlying problems. What Thomas didn't know was that a simple vitamin deficiency was the primary culprit behind his missing morning erections. Let me explain the science of morning erections and why they matter so much. Throughout the night, during REM sleep, healthy men typically experience 3 to 5 erections lasting 15 to 40 minutes each. This is a normal physiological process that occurs regardless of sexual dreams or thoughts. Research published in the Journal of Sexual Medicine has documented that these nocturnal erections serve multiple important functions. First, they oxygenate the penile tissue. The erectile tissue requires regular oxygenation to maintain health. During the day, when your penis is flaccid, blood flow and oxygenation are relatively low. The nighttime erections flood the erectile tissue with oxygen-rich blood, preventing tissue degeneration and maintaining the structural integrity of the smooth muscle cells in the corpora cavernosa second. They prevent fibrosis. Without regular erections, the penile tissue can develop fibrosis or scarring, which reduces elasticity and erectile capacity. The nighttime erections act as a stretching exercise that maintains tissue flexibility. Third, they're a diagnostic indicator. Because nighttime erections occur through a different pathway than psychologically or sexually stimulated erections, their presence or absence helps distinguish between psychological and physical causes of erectile dysfunction. If a man can achieve firm morning erections but has difficulty with erections during sexual activity, the cause is likely psychological. If morning erections are absent or weak, the cause is more likely physical, vascular, neurological, or hormonal. Research in the International Journal of Impotence Research established that the absence of morning erections is strongly associated with vascular insufficiency and predicts cardiovascular disease risk. Thomas's missing morning erections were therefore a warning sign that demanded investigation. When I evaluated Thomas comprehensively, I tested his testosterone, cardiovascular markers, blood sugar, thyroid function, and a complete vitamin panel. His testosterone was actually decent at 425 nanograms per deciliter. His cardiovascular markers showed some mild abnormalities, but nothing severe. His blood sugar was slightly elevated, but not diabetic. But one result stood out dramatically. His vitamin D level was 18 nanograms per milliliter, which is clinically deficient. The normal range is typically 30 to 100 nanograms per milliliter, with optimal levels for most functions being 50 to 80 nanograms per milliliter. Thomas was severely deficient, and this was likely the primary driver of his absent morning erections. The one vitamin that can double your morning stiffness is vitamin D, and the research supporting this connection is extensive and compelling. Let me explain exactly how vitamin D affects erectile function and morning erections. First, vitamin D is critical for endothelial function. The endothelium is the inner lining of blood vessels, and it produces nitric oxide, which is absolutely essential for erections. When you become aroused, parasympathetic nerve signals trigger the release of nitric oxide in the penile arteries and erectile tissue. This nitric oxide causes the smooth muscle in the arteries to relax, dramatically increasing blood flow into the penis. It also causes the smooth muscle in the erectile tissue itself to relax, allowing the corpora cavernosa to fill with blood, and expand vitamin D directly influences endothelial nitric oxide synthase, the enzyme that produces nitric oxide. Research published in Circulation showed that vitamin D deficiency significantly impairs endothelial function and reduces nitric oxide availability, directly limiting erectile capacity. When Thomas's vitamin D was deficient, his endothelial cells couldn't produce adequate nitric oxide, severely limiting his ability to achieve spontaneous erections, including morning erections. Second, vitamin D affects arterial health and blood flow. Vitamin D deficiency is associated with increased arterial stiffness, atherosclerosis, and impaired blood flow research in the Journal of Clinical Endocrinology and Metabolism demonstrated that low vitamin D levels correlate with increased arterial calcification and reduced arterial elasticity. The penile arteries are among the smallest in the body, and they're exquisitely sensitive to vascular dysfunction. Even minor impairments in arterial health can significantly impact erectile function. By correcting vitamin D deficiency, you improve arterial flexibility and blood flow throughout the body, including to the penis. Third, vitamin D modulates inflammation. Chronic inflammation damages blood vessels, impairs endothelial function, and accelerates atherosclerosis. Vitamin D has potent anti-inflammatory properties. Research in the Journal of Immunology has shown that vitamin D suppresses pro-inflammatory cytokines and promotes anti-inflammatory pathways. Reducing systemic inflammation improves vascular health and erectile function. Fourth, vitamin D influences testosterone production. Vitamin D receptors are present in the testicular Leydig cells that produce testosterone, and vitamin D appears to enhance testosterone synthesis. Research in hormone and metabolic research found that vitamin D supplementation in deficient men significantly increased testosterone levels. While Thomas's testosterone was reasonable, it wasn't optimal, and his vitamin D deficiency was likely suppressing his testosterone below what it could be. Fifth, vitamin D affects smooth muscle function. The erectile tissue contains smooth muscle cells that must relax to allow blood to fill the corpora cavernosa. Vitamin D influences calcium regulation in smooth muscle cells, affecting their ability to relax and contract. Deficiency impairs this function, making erections more difficult to achieve and maintain. Sixth, vitamin D has neuroprotective effects. Erections are initiated by nerve signals, and vitamin D supports nerve health and function. Research in neuroscience has documented that vitamin D deficiency is associated with peripheral neuropathy and impaired nerve signaling, which can affect the nerve pathways controlling erection. The evidence specifically linking vitamin D to erectile function is substantial. A study published in the Journal of Sexual Medicine evaluated 3,400 men without hypertension and found that vitamin D deficiency was present in 35% of men with erectile dysfunction compared to only 29% of men without ED. More importantly, the severity of ED correlated with the degree of vitamin D deficiency. Men with the lowest vitamin D levels had the most severe erectile dysfunction. Another study in atherosclerosis examined over 3,000 men and found that those with vitamin D levels below 20 nanograms per milliliter had a 32% higher risk of erectile dysfunction compared to men with levels above 30 nanograms per milliliter. A interventional study published in the International Journal of Endocrinology gave vitamin D supplementation to men with erectile dysfunction and vitamin D deficiency. After 3 months of supplementation bringing vitamin D levels to optimal range, erectile function scores improved significantly, with particular improvements in achieving and maintaining erections, and in spontaneous erections, including morning erections. Here's why vitamin D deficiency is epidemic in men over 60 and why you're likely deficient even if you live in a sunny climate. First, skin production of vitamin D decreases dramatically with age. When sunlight hits your skin, UVB radiation converts 7-dehydrocholesterol to vitamin D3. However, the amount of 7-dehydrocholesterol in the skin decreases by more than 50% between age 20 and age 70. Research in the American Journal of Clinical Nutrition documented that a 70-year-old produces only about 25% as much vitamin D from the same sun exposure as a 20-year-old. Second, many men over 60 avoid sun exposure due to skin cancer concerns. Use sunscreen regularly, which blocks vitamin D production, or spend most time indoors. Third, dietary sources of vitamin D are limited. Very few foods naturally contain significant vitamin D. Fatty fish like salmon and mackerel, egg yolks, and fortified foods. Most men don't consume adequate amounts. Fourth, vitamin D is fat-soluble, and absorption depends on adequate dietary fat and healthy digestive function. Many men over 60 have impaired fat absorption due to reduced bile production, pancreatic insufficiency, or gastrointestinal disorders. Fifth, obesity reduces vitamin D bioavailability. Vitamin D is stored in fat tissue, and in obese individuals, more vitamin D gets sequestered in fat stores and less is available in circulation. Research in the American Journal of Clinical Nutrition showed that obese individuals require 2 to 3 times more vitamin D supplementation to achieve the same blood levels as normal weight individuals. Sixth, certain medications interfere with vitamin D metabolism, including statins, corticosteroids, and some anticonvulsants. Seventh, kidney function declines with age, and the kidneys are responsible for converting vitamin D to its active form, calcitriol. Reduced kidney function means less efficient activation, even if vitamin D intake is adequate. The result is that studies consistently show that 40 to 75% of men over 60 have insufficient or deficient vitamin D levels, and most have no idea because vitamin D deficiency typically has no obvious symptoms until it's severe. Thomas began a vitamin D supplementation protocol under my supervision. Because his level was severely deficient at 18 nanograms per milliliter, we used an aggressive initial loading phase. I prescribed 10,000 international units of vitamin D, 3 daily for 8 weeks, taken with a meal containing fat to optimize absorption. Some physicians are hesitant to recommend doses this high, but research has established that doses up to 10,000 IU daily are safe for most individuals, and higher doses are necessary to rapidly correct severe deficiency. I also recommended cofactors that enhance vitamin D function and prevent imbalances. Vitamin K2 is critical because vitamin D increases calcium absorption, and K2 directs that calcium into bones. Rather than allowing it to deposit in arteries where it causes calcification, I recommended 200 micrograms of K2 daily. Magnesium is necessary for converting vitamin D to its active form and for vitamin D receptor function. I recommended 400 milligrams of magnesium glycinate daily. I also emphasized getting adequate zinc, which works synergistically with vitamin D for testosterone production. After 8 weeks, we retested Thomas's vitamin D level. It had increased to 62 nanograms per milliliter, solidly in the optimal range. More importantly, Thomas reported dramatic improvements in his morning erections. "Doc, it's remarkable," he said with obvious relief. Within about 3 weeks, I started noticing occasional morning erections. By week 6, I was waking up with firm erections 3 to 4 mornings per week. By week 8, it's almost daily again, just like when I was younger. The quality is different too. They're firmer and last longer. My wife has noticed improvements during our intimate time as well. I can achieve erections more easily. They're firmer, and I don't need as high a dose of medication. Thomas's experience matches what research and clinical experience predict. Correcting vitamin D deficiency typically produces noticeable improvements in erectile function within 4 to 8 weeks, with continued gradual improvement over 3 to 6 months as vascular health, inflammation, and hormonal function progressively optimize. We transitioned Thomas to a maintenance dose of 5,000 international units daily of vitamin D3, which kept his levels stable in the 55 to 65 nanograms per milliliter range on subsequent testing. He continued the K2 and magnesium as well. Beyond the vitamin D protocol, we addressed other factors supporting morning erections and overall erectile health. First, we optimized his cardiovascular health. Morning erections are fundamentally a vascular phenomenon requiring healthy blood vessels and robust blood flow. Thomas improved his diet, emphasizing whole foods, abundant vegetables, omega-3 rich fish, and eliminating processed foods and excess sugar. He increased his aerobic exercise to 5 days per week, which research in the Journal of Sexual Medicine has shown significantly improves erectile function through multiple mechanisms, including improved endothelial function, increased nitric oxide, reduced inflammation, and improved autonomic nervous system balance. He lost 15 pounds over 4 months, reducing his BMI from overweight to normal range. Second, we addressed his sleep quality. Morning erections occur during REM sleep, and poor sleep quality reduces REM sleep and therefore reduces nocturnal erections. Thomas had mild sleep apnea that was undiagnosed. We arranged a sleep study, confirmed the diagnosis, and started CPAP therapy. His sleep quality improved dramatically, and this contributed to the improvement in morning erections. Research in the Journal of Sexual Medicine has documented that untreated sleep apnea significantly impairs erectile function and that CPAP treatment improves it. Third, we optimized his testosterone even though it wasn't severely low. At 400 to 25 nanograms per deciliter, Thomas was in the normal range, but optimal for most men is 500 to 800 nanograms per deciliter. With the vitamin D correction, his testosterone naturally increased to 510 nanograms per deciliter. We also address lifestyle factors suppressing testosterone. He reduced alcohol consumption, prioritized sleep, managed stress through meditation, and ensured adequate dietary fat and cholesterol, which are necessary for hormone production. Fourth, we addressed his pelvic floor health. The pelvic floor muscles, particularly the bulbospongiosus and ischiocavernosus muscles, play a role in erectile rigidity. These muscles contract during erection to compress veins and trap blood in the penis, and they contract rhythmically during orgasm. Research in BJU International showed that pelvic floor muscle training improves erectile function, particularly rigidity. Thomas worked with a pelvic floor physical therapist and learned to properly engage and strengthen these muscles. Fifth, we ensured adequate intake of other nutrients supporting vascular health and erectile function, including L-arginine and L-citrulline, which are precursors to nitric oxide, omega-3 fatty acids for vascular health, antioxidants including vitamins C and E to protect nitric oxide from degradation, and B vitamins necessary for nitric oxide synthase function. The complete protocol that doubled Thomas's morning stiffness included vitamin D3 at 10,000 international units daily for 8 weeks to correct deficiency, then 5,000 international units daily for maintenance, vitamin K2 at 200 micrograms daily, magnesium glycinate at 400 milligrams daily, zinc at 30 milligrams daily, omega-3 fish oil providing 2,000 milligrams, EPA plus D, HA daily, L-citrulline at 3 grams daily, taken on an empty stomach, a high-quality multivitamin providing B vitamins and antioxidants, cardiovascular optimization through diet and exercise, sleep optimization, including treatment of sleep apnea, testosterone optimization through lifestyle and addressing deficiencies, and pelvic floor strengthening. This comprehensive approach addresses erectile function from multiple angles, but the foundation was correcting the vitamin D deficiency, which was the primary limiting factor preventing Thomas from achieving morning erections. It's important to understand that vitamin D supplementation is remarkably safe when done appropriately. Vitamin D toxicity is rare and typically only occurs with prolonged intake of doses exceeding 40,000 international units daily, or with blood levels exceeding 150 nanograms per milliliter. The symptoms of toxicity are related to excessive calcium, kidney stones, nausea, vomiting, weakness, and confusion. This is why taking vitamin K2 alongside vitamin D is important. It prevents inappropriate calcium deposition. Regular monitoring is wise when taking higher doses. I recommend checking vitamin D levels at baseline, then after 8 to 12 weeks of supplementation to ensure you're reaching optimal range, then annually or semi-annually to ensure maintenance dosing is adequate. The blood test you want is 25-hydroxyvitamin D, which is the standard measure of vitamin D status. Some important points about vitamin D supplementation. First, always use vitamin D3, not D2. D3 is the natural form produced in skin and found in animal foods, and it's significantly more effective at raising blood levels than D2. Research in the American Journal of Clinical Nutrition showed that D3 is approximately 87% more effective than D2 at raising and maintaining vitamin D levels. Second, take vitamin D with a meal containing fat. Vitamin D is fat-soluble, meaning it requires dietary fat for absorption. Taking it on an empty stomach significantly reduces absorption. Third, timing doesn't matter much for most people, but some find that vitamin D taken late in the day can interfere with sleep due to its effects on melatonin. If you experience this, take it in the morning with breakfast. Fourth, don't expect immediate results. Unlike medications that work within hours, correcting vitamin D deficiency and experiencing the benefits takes weeks. Most men notice initial improvements in erectile function and morning erections around week 3 to 4. With progressive improvement continuing for 3 to 6 months. Fifth, vitamin D is not a magic bullet. If you have severe vascular disease, uncontrolled diabetes, very low testosterone, or other significant underlying conditions, vitamin D correction alone won't fully resolve erectile dysfunction. However, it's a critical foundation that allows other treatments to work more effectively. Sixth, more is not always better. Once you reach optimal blood levels around 50 to 80 nanograms per milliliter, taking more vitamin D doesn't provide additional benefits and increases the risk of toxicity. This is why testing and adjusting dosage based on results is important rather than just taking high doses indefinitely without monitoring. Finally, don't forget the cofactors. Vitamin D doesn't work in isolation. Magnesium, K2, zinc, and adequate dietary fat are all necessary for optimal vitamin D function. The broader implications of vitamin D for men's health extend far beyond erectile function. Vitamin D deficiency is associated with increased risk of cardiovascular disease. The research in Circulation showing that men with the lowest vitamin D levels have twice the risk of heart attack compared to those with optimal levels. Increased risk of diabetes, with vitamin D playing a role in insulin sensitivity and glucose metabolism. Increased risk of certain cancers, including prostate cancer, with research showing that adequate vitamin D levels are protective. Increased risk of depression and cognitive decline, with vitamin D receptors present throughout the brain. Increased risk of osteoporosis and fractures due to impaired calcium absorption, and increased risk of autoimmune diseases and infections due to vitamin D's crucial role in immune function. By optimizing your vitamin D, you're not just improving morning erections, you're comprehensively improving your health across multiple systems. Thomas's transformation over 6 months was remarkable. His vitamin D levels stabilized in the optimal range. His morning erections returned to nearly daily occurrence with good firmness. His erectile function during sexual activity improved significantly, allowing him to reduce his PDE5 inhibitor dose by half. His energy and mood improved noticeably. His cardiovascular markers improved with triglycerides decreasing and HDL cholesterol increasing. His testosterone increased naturally by about 80 nanograms per deciliter. His sleep quality improved dramatically with PAP treatment and better sleep hygiene. His relationship with his wife strengthened as sexual intimacy became less stressful and more satisfying. His overall quality of life improved substantially. He described feeling more vital, energetic, and optimistic than he had in years. The foundation of all these improvements was correcting the vitamin D deficiency that had been silently undermining his health for years. If you're experiencing absent or weak morning erections, here's your action plan. First, get your vitamin D level tested. Don't guess or assume. Test. The test is inexpensive, widely available, and covered by most insurance. Ask your doctor for a 25-hydroxyvitamin D blood test. Second, if your level is below 30 nanograms per milliliter, you're deficient and need supplementation. If it's between 30 and 50 nanograms per milliliter, you're insufficient and would benefit from supplementation. If it's above 50 nanograms per milliliter, you're in the optimal range, and vitamin D deficiency isn't your primary issue. Look for other causes of your erectile problems. Third, if deficient, start supplementation. For severe deficiency below 20 nanograms per milliliter, consider 10,000 international units daily for 2 to 3 months under medical supervision. For moderate deficiency or insufficiency, 5,000 IU daily is typically appropriate. Fourth, always take vitamin D3 with cofactors, K2, magnesium, and zinc, and with a meal containing fat. Fifth, retest after 8 to 12 weeks to ensure you're reaching optimal levels and adjust dosage as needed. Sixth, once optimal, continue maintenance dosing. Most men need 2,000 to 5,000 IU daily to maintain optimal levels, with the specific dose depending on body weight, sun exposure, skin tone, and individual metabolism. Seventh, address other factors affecting morning erections and erectile health, cardiovascular health through diet and exercise, sleep quality, including evaluation for sleep apnea, hormonal optimization, including testosterone, stress management and mental health, pelvic floor strengthening, and adequate nutrition, including protein, healthy fats, and other vitamins and minerals. Eighth, be patient. Correcting vitamin D deficiency and experiencing the full benefits takes time. Give it at least 3 months of consistent supplementation before concluding whether it's helping. The one vitamin that can double your morning stiffness is vitamin D, and the evidence is clear. Morning erections are a vital sign of vascular, neurological, and hormonal health. Their absence is a warning sign that demands attention. Vitamin D deficiency is epidemic in men over 60 and directly impairs erectile function through multiple mechanisms: reduced nitric oxide production, impaired endothelial function, increased arterial stiffness, elevated inflammation, reduced testosterone, and impaired smooth muscle function. Correcting vitamin D deficiency through proper supplementation with cofactors, combined with comprehensive attention to cardiovascular health, sleep, hormones, and lifestyle, can restore morning erections in many men and significantly improve overall erectile function and health. Thomas's story demonstrates what's possible when you identify and correct the underlying deficiency that's been silently undermining your sexual health. Thank you for watching Men's Health 365. If you found this video helpful, please like, subscribe, and share it with men who might benefit from this life-changing information.